One of the most important days in the lives of South Korean young people is coming up next month, the annual college entrance exam. New cases of COVID-19, though, are on the rise again. The authorities are working to make sure each student can take the exam in the best environment possible. So they've announced a plan to prevent the spread among students and enable them to take the test at other locations in case they've been infected. Yoo-jin has the details.
November is a big month for high school seniors here in South Korea. They'll be taking the Suneung, the annual college entrance exam, on November 17th. This is the third year for it to be taken during the pandemic. The country's education ministry on Tuesday announced some virus protocols for test takers. First, all high schools and designated test centers will be advised to fully turn to remote learning from November 14th, 3 days before the exam, to prevent a possible spread of the virus. And just like the past 2 years, there will be separate test sites for those infected with COVID-19. Those who test positive from November 11th will need to self-isolate for 7 days and take their tests at one of 108 designated schools. Until last year, confirmed cases were only allowed to take their tests in the hospital or at a treatment center where they had to remain until their self-isolation period ended. In addition, people who have serious COVID-19 symptoms will be taken to 24 designated medical centers to test there if they're feeling up to it. Those who show COVID-like symptoms without a positive test result will be assigned to separate classrooms. And to minimize any disruptions caused by the pandemic, the ministry will closely inspect the virus prevention efforts of facilities often visited by test takers, like cram schools and study cafes. This comes as South Korea is seeing a rise in COVID-19 infections. 33,248 cases were reported on Tuesday, more than double what was seen the week before. The daily virus tally has been showing an on-week increase for 5 straight days. There were 5 COVID-related deaths and 247 patients are critically ill. Yoo-jin, Arirang News.